I'll be talking on smartphone-based arrhythmia detection, which is kind of a new modality of detection of arrhythmias. So this picture is probably known to most electrophysiologists. This is the birth of the specialty. And this person, the father of electrophysiology, or father of ECG, William Einthoven, is performing the world's first ECG on the world's first ECG machine. And you can see it occupies half of his room. So the evolution of the ECG machine has been from the string galvanometer to the latest ECG machines, and probably going slimmer and smarter. So recently, the two broad groups of smartphone-based detection of arrhythmias have been innovated. One is the AliveCor, or the ECG check, which is basically a app along with an external case for the smartphone, and the other one is Cardiio rhythm, which is only an app-based. The principle that the Cardiio rhythm basically uses is the photoplethysmography, which is actually measuring the changes in the tissue blood volume produced by the pressure of the pulse. The AliveCor heart monitor, it is FDA approved. It consists of a case which has two metal electrodes on the back. And when the metal electrodes are touched by the right and left hands of the user, a bipolar lead 1 is produced. So the cardiac signal then gets converted to a FM signal, which is detected by the smartphone and reconverted to a digital ECG tracing. A small video which demonstrates how the AliveCor works.
So essentially what we've done is we've taken a traditional smartphone cover and turned it into a medical device. This cover is very much like you would have on a phone normally, and it has two electrodes built in, a battery and some wireless circuitry which talks to the phone. It sits directly on like any other cover, and once you unlock it you can open the app that you've downloaded from the iTunes store, and immediately it's ready to go. The next steps is simply to put your fingertips on the back of the case and hold steady, and you'll notice there my heart rhythm. This is now storing it on the phone encrypted, and it's ready to upload to the cloud storage. And you can see that's now ready for review, and that can also be viewed. So
that's how it works. So the AliveCor has been evaluated and validated extensively. One of the important studies were the SPEAR trial, in which they saw patients, mainly 35 children, and they found that there was high satisfaction amongst the users. They found 96% tracings were pretty good quality for diagnosis, and the common arrhythmias found were ectopics, VT, and supraventricular tachycardia. Several other studies have found sensitivities of around 72% for QRS delay, and as high as 94% for atrial fibrillation and atrial arrhythmias. Also, the specificity is about 94%, so the ability to rule out is pretty high. Other uses of AliveCor have been to detect the ST elevated MI, monitoring QRS duration in drug-induced QTC prolongation or long QT syndromes. Recently, they have upgraded and renamed the whole thing as Cardiio, and they have upgraded to wearable wristbands, and have included some arrhythmia or AF detection algorithms in their app. The app is, I think, widely available for use with iPhone 4 and 5. Similarly, there is another device which is called ECG Check by a different company, works on the same technology and has the similar efficacy. A study by Lau and colleagues actually administered this device in 1,000 pharmacy customers, and they've noted that they found 1.5 or 15 new AF patients. The other device, Cardiio Rhythm, is basically an app-based system. What it does is you just have to place your finger at the tip of the flash and the camera of the iPhone, and depending on it, it passes the light through your fingers, similar to the SpO2 plethysmograph. And depending on the pulsatility signals that it catches, it generates a trace, which, if irregular, can be presumed or diagnosed to be AF. However, because we don't have a real ECG trace, the chances of having a false positive AF or false positive AT is pretty high. So that's as small as how the sensor of the device looks, and these sensors, they detect the change in the tissue blood volume. A study performed to compare AliveCor versus Cardiio Rhythm found that AliveCor had a pretty good elimination of true negatives, and they did find around 20 true AF patients, as against Cardiio Rhythm, there were 22 false positives, but the Cardiio Rhythm did have a significance of smart devices to detect arrhythmias. This handheld my diagnostic, a handheld ECG, then this sphygmomanometer, which also detects the arrhythmia based on the pulse. Sorry, and this Cardiio miniaturized AliveCor device with the 2 electrodes. So in the Indian setting, is AliveCor available? I personally don't have any experience with administering AliveCor, but I have been told that it's available via Apollo hospitals. And on Amazon you can find it for $199. Cardiio Rhythm app is available on app stores, and it has a lot of in-app purchases you can make for $13, $40 and whatever. So smartphone based devices, they are quite handy and they are convenient. Also patients don't have to actually visit your clinic to be detected. I think they can definitely improve the detectability of paroxysmal AF or those arrhythmias in which there is a doubt whether an arrhythmia exists at all, and definitely they are creating a new revolution. However, we at Raipur are also using this device, which is called a Viscope, for our screening program in the community. So it is a combination of the electronic monitor with the ECG and the electronic Littmann stethoscope. The newer version of this device will have a Bluetooth enabled chip. Yeah, I'm done.